Hi, I am Dr. Vinoth Kumar, interventional cardiologist. Today I am going to talk about one important topic like coronavirus and heart. Many people ask, coronavirus, will it affect heart? Yes, coronavirus not only affects the lungs, it also affects the heart. We know coronavirus enters the body through the mouth, nose and eyes and travels to the lungs and damages the lungs. But recently, since 2 to 3 months, we have seen significant number of deaths in coronavirus is related to heart attack and heart failure. How this coronavirus causes heart attack and heart failure? This coronavirus enters the body, travels to the bloodstream. In that, blood vessels are damaged. It attaches to the blood vessels and causes damage to the blood vessel and then clot formation. This clot in the blood vessels can happen in the heart, can happen in the brain, can happen in the kidney, can happen to the lungs. So when this clot formation becomes 100%, it can happen in healthy heart also. A 35-year-old young person without any problem, good blood vessels, they also can get damaged by the clot formation. When the clot becomes 100%, heart gets damaged, the damage starts and the patient will start feeling chest pain. Number 2, the coronavirus directly can affect the heart and it can reduce the pumping capacity of the heart. So when coronavirus is causing clot formation and causing heart attack, what are the symptoms? Symptoms of heart attack, whether it is due to coronavirus or whether it is due to cholesterol deposition, it is the same. Patient will have chest pain and starting from here to here, anywhere from the throat, center part of the chest, left side of the chest or right side of the chest, heaviness or burning sensation or tightness or only pain. It can happen in any form, some discomfort. Some people will not be able to explain a sort of pain. They can only tell some discomfort. That discomfort can be radiated to the left hand, it can be radiating to the right hand or sometimes to the throat. So this pain, when it happens for you in the house, immediately you should seek medical attention. It may be a sign of major heart attack. Nowadays, because of the corona fear, we see majority of the patients coming to the hospital after 4 to 5 days of heart attack. By the time 50% of the heart is already damaged and they are in a bad position, heart pumping capacity already would have come down dramatically. So when the heart attack sets in, what you are supposed to do? When there is a heart attack, immediately you seek medical attention within 12 hours. So if you reach the hospital within 3 hours, you get the maximum benefit. Almost 80% of the heart is saved. Sometimes even 90 to 95% of the heart, even 100% also sometimes, if you reach within 1 hour. So when heart attack manifests like chest pain, immediately come to the hospital within 3 hours. If you go at 11th or 12th hour, only 10 to 20% of the heart muscle you can save. So always we advise patients, if you have chest pain during this COVID time, don't think about coronavirus, don't think about other thing. Immediately rush to the hospital to take ECG and necessary investigation to find out whether it is really a heart attack or other pain. Once if it is a heart attack, necessary treatment will be given immediately. Either it can be an injection treatment or it can be a stent treatment, whatever treatment it may be, but the treatment will be given immediately. So majority patients, what they think, right? They think that it is a gastric problem, they take some antacid, stay at home. Don't do that mistake. If you have chest pain or breathing trouble, sometimes you may be totally normal. Within 2 to 3 days, you will develop some sort of breathing trouble, even at rest or while climbing upstairs or for walking 1 to 2 kilometers. So breathing trouble also can be a symptom of heart attack. So don't think about corona when you have chest pain. There is no time for anything. You have to go to the nearest hospital and get the treatment. And there are 2 types of treatment is available for corona, the coronavirus causing heart attack. Any heart attack, of course, there is stenting method and one is injection method. 2 methods are available. Now due to widespread coronavirus infection, everywhere there is a bed scarcity. The hospitals are also very busy taking more number of patients, they are caring for patients. If there is any delay in treatment, any treatment, immediately whatever treatment available, either it is injection treatment or stent treatment, try to get that treatment. Injection treatment, whichever modality of treatment, it doesn't matter. Whatever treatment which is available earlier, you should take. See, some people are periphery, injection treatment will be available. Now majority of the government hospital, they have a very good facility with injection treatment. If you are in periphery also, don't try to travel to a far away hospital for stenting treatment. If your hospital is having injection treatment, whether it can be a small place also, if you are nearest town having injection treatment in a government hospital or private hospital, wherever you are, if they are providing the injection treatment, get the treatment as early as possible. It is not the type of treatment that is important now. It is the type of treatment, it's the how fast you are getting the treatment is more important. So get the injection treatments, get stabilized, then travel to a longer distance for a tertiary care center. So chest pain if you develop, the summary I want to tell, the chest pain if you develop, immediately go to the hospital, get the treatment as early as possible and keep yourself healthy. Thank you.